at the end of the day, anytime we create space in the body, which we always do, our body wants to fill it up with fluid. And we don't want that fluid sitting there because it doesn't allow you to heal properly. So leaving those drains takes out the fluid so that you can heal.
Hi guys, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm Dr. Ashley Amalfi, and joined with me is my friend and co-host, Dr. Smita Ramanathan. Hi Smita.
Hi Ash. Hi everyone.
We are excited, guys. This is a new series, and this one we are calling Show and Tell. So we are going to go through all of these common things that you get to use or need during your surgical recovery, and we are going to show you them, explain how they work, and get all the mystery out of everything that's about to happen. So this will be fun, way more fun than like show and tell in kindergarten, right, Smith?
I know. And it's so great because I feel like we always talk about, in the office, I rarely have little props with me, right? Unless it's in breast implants. And so patients are like trying to imagine what I'm talking about without ever having to see, like having seen it in the past. So I feel like this is a great series. It's really going to help out.
Yeah, I think you guys are going to watch all of this stuff before surgery. We're kind of going to be like a magician, just like pulling things out of our hats because we can't do that in the office. So you're going to tune in here if you want to see these things and see what they're like. Yeah. We're going to start. So I thought it would be perfect to start with the most commonly requested item to see for show and tell, which is a drain, right?
Yep.
If someone has never had a drain in their life or taken care of anyone who has a drain, they have no idea what it looks like to have a drain in their body.
They have no idea. And I'm always like, okay, they've heard of drains. They look at me like, I'm not really sure. I'm like, it's like a tube with a grenade attached to the bulb. And they're like, that seems a little weird, but it is.
It is. So this is going to be like unboxing videos for plastic surgeons, right? So this stuff all is used in surgery, so it comes sterilely. We're going to obviously make it unsterile so we can take a look. But the drain has kind of two parts to it. The first part is what we put in during surgery. I'm going to have a whole pile of garbage here at the end of this series. So I put my drain in sharply, and but all that matters is the part that you guys see. So a drainage tube is like a long spaghetti. Like it's actually really, really long. This white part, the one end that has the tiny little holes in it, this part's in your body, so you don't see it. And then it will come out of your skin. So just part of this little tube is what you're going to see hanging out of your skin, which sounds kind of weird, but it's just a tiny little straw. It's rubber, it's flexible, silicone, and it's going to drain the blood and the fluid out from your surgical site. So your tummy tuck, breast augmentation or revision breast surgeries. Where do you use tummy tucks, Smita? Or sorry, where do you use drains?
Drains? I definitely in tummy tucks, body lifts, and then like you said, revision breast surgery, or when I explant and take out breast implants, you want to fill in that space because at the end of the day, anytime we create space in the body, which we always do, our body wants to fill it up with fluid, and we don't want that fluid sitting there because it doesn't allow you to heal properly. So leaving those drains takes out the fluid so that you can heal. And I use them in my neck lifts too, but tiny ones. So
the one I just showed you was a little bit tiny, which would be more used in face. The ones in your body are just a little bit bigger, meaning like the caliber of that straw is a lot bigger. But what you guys are going to see is this part of it, right? And this is going to be in all of our tummy tucks. There are some people who do drainless tummy tucks. I know you and I do not.
I don't.
Because it's important. It's important to not have blood in that space so you can have the flattest tummy possible. So this is Smita said a grenade, and we call it that because it kind of is shaped like that. It's got a little tube here that's going to connect to the tube in your body. So you remember you're going to have that that long skinny tube coming out, and that tube goes into here, and then the other end is closed. And then if you close it, and you can hold suction, so when you empty your drain, you kind of squeeze it down, and it'll have kind of this squished down like raisin appearance where it's like squashed down and flat. That's how you know the drain is working, and it's pulling with suction, and that gravity and suction are going to pull that fluid through the tube and out of your body. And then it just collects in here, right? It's a little weird, maybe seems a little scary if you've never had one, but honestly not a big of a deal once you get the hang of it.
Right. And that's the thing. I think people are nervous about it. You guys are all nervous because you think it's going to hurt or be uncomfortable. And it's really not. It's just annoying. It's just another thing that you have to deal with, and you have to pin to your garments or, hide under your clothes. But it's actually really painless. It's not going to fall out. We make sure it's secured, so it's not going to slip out. But the cool thing about those little grenades, the bulbs, is they do have measurements on them.
Yeah.
So, both you and I and most of us plastic surgeons, we have different criteria that needs to be met before we remove the drains. And so you can easily measure it out directly in the bulb, dump it in your toilet, and write down the numbers for us, so we can make sure we're taking them out appropriately.
Yep. You'll just kind of squeeze it out, and then there's numbers on the bulb, and sometimes you can even get little cups that have numbers on there, so you can see how many milliliters is coming out, and then you tell the doc, and then that's how we know when it's ready to come out. And like Smita said, it's sometimes nice to just secure these to your clothes so that they're not dangling around, and it has like this little tiny hook of plastic, and so a lot of people just use a safety pin and put a safety pin through that and kind of safety pin it to the top of their garment or their pants, or put it into the pocket of like a hoodie, sweatshirt, or something like that. But nothing to be scared of. Pretty simple to use. The other thing that we talk about is kind of milking your drains. And so that means you kind of squeeze the tubing so that it pulls with suction the extra fluid out of your body. And to do that, you literally just kind of pinch your fingers, hold one finger steady, and pull the other, and that will kind of milk the fluid through your drain. Sometimes a trick, I don't know if you guys ever did this in residency, is we would use a little alcohol swab because it helps kind of slide along this a little better. So you can put an alcohol swab between your fingers and kind of slide that. And sometimes the drains get a little clogged because these tubes are little, right? And you want to keep milking it, and you can get those clogs out of there. Sometimes it's just a tiny little clot of blood, but just keep working on it and you'll get it.
Exactly. And then the other thing too, those little loops on the bulb, Ash, patients can use a lanyard or something and slip it through for a shower. So that's the other thing. Like, what do you do with these drains when you're in the shower? And you can just slip that loop through a lanyard or whatever, rope, whatever you have, and just hang it around your neck. And they're protected
like a necklace, right?
Exactly.
So anything that goes around your neck that kind of hangs, then it's not pulling on your skin, because this tube is secured to your skin, so you don't want it to pull when you're in the shower or walking around and be uncomfortable. But I mean, that's really it. I don't be scared of your drains. It's going to feel a little weird at first. It's kind of clunky. You're going to be worried you're going to make a mess. And then I promise you'll be a pro at this after 24 hours. Your caretaker will be a pro at this. Drains are, the least fun part of all of this because they really are a nuisance, but they're not terribly painful. They're just kind of a nuisance.
Yeah. And they're not even painful coming out too. I think that's the other thing that you guys are worried about when we take them out in the office. I feel like everyone's bracing. And then I take it out and they're like still waiting for me to take it out. And I'm like, it just feels funny, like a weird tickle on the inside, but it doesn't hurt.
You kind of feel this little piece kind of sliding through and it feels a little strange, but it doesn't have a lot of sensation. It can feel just like it's a little tug, but usually it's so much better tolerated than people are kind of hoping and worrying about when they come in for that visit. So don't stress. This is easy stuff. The drains coming out is a good day, guys. Not a bad day.
It's a great day.
Drain-free life is the way to be. I had a patient say that recently, but everything is better once that drain is out.
Yeah. Yeah, no, absolutely.
Awesome.
Well, I love this. So this guys you should be comforted and the drain, that's all it is. It's so easy, piece of cake, and you've all survived much more worse. So you're good with the
Yes,
drains.
and now you know. And congratulations on getting ready for your surgery or being done with your surgery. And your drains will be out soon, I promise. And just like anything, those days feel long, but the time that you have that drain will be short in the grand scheme of your beautiful results.
Yeah.
So stay tuned. We're going to show you guys lots more in our show and tell series. And make sure you subscribe to Lipstick and Lipo so you can learn more about plastic surgery. All right, girly.
Bye.
See
See you
you
guys
soon.
later.